My name is Juveria Zaheer. I'm a psychiatrist and researcher at the Center for Addiction and Mental Health. In my clinical role, I work in the CAMH emergency department. In my research role, I work within the Institute for Mental Health Policy Research with a focus on suicide prevention. In suicide prevention, we tend to focus on rates and risk factors on a population level. My work serves to give voice to the people who have been affected by suicide and to use their powerful stories and expertise to inform suicide prevention strategy. It's an analysis of complex phenomenon by using the stories and lived experiences of people who have been through the system. Preventing suicide isn't just about a medication or a brain scan. Preventing suicide is about understanding people's experiences. Data tells us what's happening. It doesn't tell us why. Qualitative work can tell us why. It can also lead our focus in suicide prevention beyond just symptoms, and being able to demonstrate that in a rigorous way allows us to inform policy and allows us to inform more quantitative interventions in the future. By interviewing people who have suffered, their family members, their care providers, we can develop a robust model for what it looks like to have suicidal thoughts. That robust model, built from common experience, can inform how we identify people at risk, how we destigmatize suicide, and how we can develop strategies to prevent it. I think mental health is so quiet. People who are distressed, they don't talk about it. As a society, we don't acknowledge it. And then we find out that people that we care about have ended their lives or have suffered and we had no idea. We have a responsibility to understand what the barriers are to recovery, what the barriers are to accessing services, what the barriers are to staying safe. Because unless we actually hear from the people who are affected, we're never going to make any progress. Winning the Breakthrough Challenge would be a real game changer. Qualitative research in healthcare in general is pretty new, and it makes it a little bit difficult to get funding. On the other hand, you can do a lot with $10,000 in qualitative research, but you can't do maybe as much in other types of fields. And so with this $10,000, I would be able to initiate the study that we're hoping to do, which will interview family members from people in the Greater Toronto area who have lost someone to suicide, to better understand how we can improve mental health care and policy.